CEN Test Prep Exam Tips. Question 1. A patient with chronic COPD presents with increased dyspnea. The nurse understands that the primary stimulus to breathe in these patients may be Option A, elevated PaCO2. Option B, low PaO2, hypoxic drive. Option C, increased pH. Option D, elevated HCO3. The correct answer is option B, low PaO2, hypoxic drive. Question 2. A patient with a suspected spinal cord injury develops hypotension and bradycardia. The nurse suspects Option A, hemorrhagic shock. Option B, neurogenic shock. Option C, cardiogenic shock. Option D, anaphylactic shock. The correct answer is option B, neurogenic shock. Question 3. Sengstaken minus Blakemore tube placement is used as a temporizing measure for bleeding from Option A, peptic ulcer. Option B, esophageal varices. Option C, diverticulosis. Option D, aortoenteric fistula. The correct answer is option B, esophageal varices. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. The hallmark sign of compartment syndrome is Option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Question 5. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option C, tachycardia. Question 6. A female patient of childbearing age with abdominal pain should always be evaluated for Option A, ovarian cysts. Option B, pregnancy status. Option C, endometriosis. Option D, PID. The correct answer is option B, pregnancy status. Question 7. A patient presents with sudden minus onset worst headache of my life. The nurse's first priority is Option A, administer pain medication. Option B, perform a complete neurological assessment. Option C, prepare for lumbar puncture. Option D, obtain a non-minus contrast CT scan of the head. The correct answer is option D, obtain a non-minus contrast CT scan of the head. Question 8. In a multiple minus casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is Option A, green, minor. Option B, yellow, delayed. Option C, red, immediate. Option D, black, deceased/expectant. The correct answer is option C, red, immediate. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to Option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C, irrigate the bladder with normal saline. Option D, prepare for suprapubic catheter. The correct answer is option B, perform a retrograde urethrogram before catheter insertion. Question 10. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents Option A, uncompensated respiratory acidosis. Option B, compensated respiratory acidosis. Option C, uncompensated metabolic acidosis. Option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. Question 11. The most critical treatment for a patient with heat stroke is Option A, oral rehydration with electrolyte solution. Option B, rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Option C, the administration of antipyretics. Option D, active external revarming. The correct answer is option B, rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Question 12. The best method to remove a prosthetic eye in an emergency is: Option A, using forceps to grasp the prosthetic. Option B, applying suction with a bulb syringe. Option C, using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. Question 13. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A, pulmonary fibrosis. Option B, right ventricular failure. Option C, left ventricular hypertrophy. Option D, atelectasis. The correct answer is option B, right ventricular failure. Question 14. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to: Option A, patients with private insurance only. Option B, any person who comes to the ED and requests care. Option C, U.S. citizens only. Option D, patients with urgent conditions only. The correct answer is option B, any person who comes to the ED and requests care. Question 15. The most common cause of acute renal failure in hospitalized patients is: Option A, glomerulonephritis. Option B, acute tubular necrosis. Option C, renal calculi. Option D, pyelonephritis. The correct answer is option B, acute tubular necrosis. Question 16. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, a neurological status. Option B, a renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Question 17. A patient leaving against medical advice, AMA, must be informed of: Option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. Question 18. In distributive shock, the primary pathophysiology is: Option A, pump failure. Option B, widespread vasodilation and increased capillary permeability. Option C, fluid volume loss. Option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is: Option A, application of ice to the bite. Option B, incising and suctioning the wound. Option C, application of a tourniquet proximal to the bite. Option D, administration of antivenom, crotality. The correct answer is option D, administration of antivenom, crotality. Question 20. Murphy's sign is used to assess for: Option A, pancreatitis. Option B, acute cholecystitis. Option C, diverticulitis. Option D, small bowel obstruction. The correct answer is option B, acute cholecystitis. Question 21. The emergency nurse suspects acute epiglottitis in a patient presenting with: Option A, inspiratory stridor, drooling, and tripod positioning. Option B, barking cough, low-grade fever, and hoarseness. Option C, productive cough, pleuritic chest pain, and fever. Option D, a wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A, inspiratory stridor, drooling, and tripod positioning. Question 22. The antidote for acetaminophen overdose is option A, naloxone, option B, N-acetylcysteine, option C, aflumazenol, option D, sodium bicarbonate. The correct answer is option B, N-acetylcysteine. Question 23. The safe harbor provision for nurses typically refers to option A, a law that provides legal immunity in all circumstances, option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation, option C, a hospital policy allowing nurses to refuse any assignment, option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Question 24. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mmHg and in the left arm is 130/80 mmHg. The chest X-ray shows a widened mediastinum. The nurse suspects option A, acute myocardial infarction, option B, thoracic aortic dissection, option C, pulmonary embolism, option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. Question 25. To calculate cerebral perfusion pressure, CPP, the nurse needs to know option A, heart rate and blood pressure, option B, mean arterial pressure, MAP, and intracranial pressure, ICP, option C, respiratory rate and oxygen saturation, option D is central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP.